how can AHSNs help people get access to these digital services?
Sure. So, well, shameless plug here. So we have our website, kssahsn.net. And one thing I should have mentioned is we're commissioned by NHS England and Improvement and the Office of Life Sciences to support the adoption and spread of innovation. So that that covers a number of clinical themes, so mental health, maternity, cancer, and various others. And one thing that's a fundamental element of the way we do the spread of innovation is linking that to quality improvement as a principle and working with local stakeholders to first of all understand their needs, their system needs, the needs of their populations, the populations they serve, making sure that those needs are clearly communicated to innovators who are still trying to navigate the health and social care maze or wider system or labyrinth or whatever the analogy is you want to use, and making sure that they design interventions that are effective and work for them. The next step is around real-world validation, essentially testing in layman's terms. Something that works in one part of England, in the north, for example, might have a different impact in the South Kent coast, for example, with a different population and a different cohort, different communities and different neighbourhoods. So we work with innovators as well and the systems or organisations and populations that we're testing these solutions in to make sure that they're effective. And then we go into adoption and spread. So we have a number of programs within our portfolios which include digital programs or the acceleration of adoption of digital solutions. And the way we support is through essentially helping with the redesign of pathways, helping to advise around patient safety initiatives that are currently underway nationally or even locally or regionally, and connect people with organisations who are working in that space to make sure that those programs are delivered. So one of the challenges that can be faced in an environment such as this is having that diktat and mandate, thou must do such and such. And that gets people's backs up, particularly where we've got a workforce that is stretched during a pandemic. We are there to help facilitate those conversations and help smooth out that process and help understand what some of those barriers are to adoption to make sure that those are lifted. Some of those barriers could be around engagement of clinicians, they could be barriers around engagement with the populations that we work with and serve. And some of those barriers can be around procurement, which James alluded to earlier. So AHSNs essentially exist to help the adoption of innovation work and address some of those barriers and help to lift them. So you can get in touch with us via my email directly, so george.anibaba@nhs.net, particularly on this topic of digital inclusion. But more broadly, we have a wide workforce that works across those programs and clinical themes that I alluded to earlier. So if you have a specific question around that, you can get in touch directly with them. And on our website, information on our general mailbox is also available. But essentially, we are here to support the health and social care system with their needs.